Okay, so imagine this. You're a transplant recipient, right? Years out from that big surgery, you're feeling good, life is almost back to normal, and then bam, appendicitis, or maybe it's gallstones or something else completely routine. You'd think, okay, another surgery, no big deal, right?
You'd think so, wouldn't you?
But today's deep dive, we're going to totally flick that script. We're diving into the world of transplant patients. Yeah, but not the transplant itself. We're talking about those everyday surgical issues most people wouldn't even blink at, but through the lens of someone whose body is, well, let's just say it's a bit more complex.
Definitely complex. And it's fascinating, really. It's this whole area of medicine where your past medical history, it's not just some file in a cabinet. It's like the rule book, the foundation for every single decision going forward.
Exactly. And we've got this, I'm not going to lie, kind of intense sounding article here called, get this, Managing Acute General Surgical Problems in the Transplant Patient. Okay, so first things first. What makes this such a big deal? Why can't our transplant patients just, sail through a routine surgery like anyone else? What's the big difference here?
Well, you've got to remember the bigger picture, right? The fantastic news is transplant patients are living longer now than ever before. But that also means, statistically, they're way more likely to encounter these other health issues that, honestly, have nothing to do with their original transplant.
So it's not just about the organ anymore, it's about like the whole patient.
Bingo. We're talking about generally an older population of patients who may already have other health challenges going on, diabetes, heart disease, you name it. It's like their bodies are already working overtime just to stay healthy, and then you throw a burst appendix into the mix.
Okay, yeah, that paints a pretty intense picture. And then there's the whole issue of those immunosuppressant drugs. The ones that stop your body from rejecting the new organ. This article mentions them constantly.
Rightfully so.
It sounds like they're almost like a double-edged sword. Help on one hand, hurt on the other.
That's a really good way to put it. I mean, let's be real. Without these meds, organ transplantation wouldn't even be possible, right? They keep your immune system from basically waging war on that new organ. But the trade-off is they also suppress your immune system's ability to fight off anything else. And I mean anything. Could be a common cold. Could be, well, you get the idea.
So something that most people would just shrug off, like a minor infection, could actually be life-threatening for a transplant patient.
Exactly. You're hitting the nail on the head. And it doesn't stop at infections either. These medications have this whole laundry list of potential side effects. We're talking delayed wound healing, weird reactions to anesthesia, you name it.
See, that's what gets me. That's a little scary, honestly. Are there any, specific examples of these side effects that really drive home just how risky this all is?
Let's talk about prednisone for a sec. It's a really common immunosuppressant. High doses of prednisone. They can actually make your tissues weaker, so weak that they might not even hold stitches properly.
Whoa.
Yeah, imagine that. You go through this whole surgery, but your body might not even be able to heal right because of the medication you need to stay alive. The risk of complications just goes through the roof.
Wow. Okay, so we've got all that going on. Then this article also mentions something called altered presentations. What in the world does that even mean?
All right, so think about the classic appendicitis scenario. Sudden, intense pain. Right, something is wrong, something is very wrong. But here's the thing. For transplant patients, especially those on immunosuppressants, those big, obvious warning signs, they can be way more subtle. Sometimes they're practically non-existent. They might not experience the same level of pain, so they might not even realize how serious it is.
So doctors might not catch it in time either.
Unfortunately, that's a real concern. Any kind of delay in treatment, even just a matter of hours, it can have huge consequences. It really becomes a race against time, but without the usual alarm bells going off.
That's terrifying. It's like their bodies aren't even communicating the problem properly.
You're exactly right. That's a great way to put it. And that's why pre-surgical planning for these patients is absolutely crucial. We're not talking about your average run-of-the-mill pre-op checkup here.
So what does that actually look like then? It can't just be a quick blood test and you're good to go.
No, not even close. We're talking a whole team effort. I mean, think like a full-blown medical conference, but just focused on this one patient. You've got your transplant specialists, surgeons, anesthesiologists, everyone huddled up, making sure they're on the exact same page because they're dealing with this incredibly delicate balance of risks and benefits. Everyone needs to understand the patient's unique history and what they're up against.
Wow. So I'm guessing, they also have to factor in the original transplanted organ during any of these unrelated surgeries, too.
100%. Think about it. A transplanted kidney. It's often placed lower down in the body, which makes it more vulnerable during any kind of lower abdominal surgery. And the liver, don't even get me started. That's a whole other ballgame. It needs a constant blood supply, so even the slightest interruption can be a major problem.
It's kind of mind-blowing when you think about it like that. It's like every little thing has to be planned out so carefully. But okay, let's say best case scenario, the surgery itself goes off without a hitch. What about afterwards, during recovery? Are there still potential complications even then?
Unfortunately, yeah. Complications, they're just more common with transplant patients, and they can be a lot more serious too. These patients, their bodies are already working so hard just to maintain, and then those immunosuppressants, which we know are essential, they complicate things even further.
So what are we talking about here? What specific complications should doctors be extra careful about during recovery?
Well, infections, those are always top of mind. We've talked about how vulnerable their immune systems are. But another biggie is hernias, especially incisional hernias. Those are the ones that can develop around the surgical cut.
Because the area is weaker.
Exactly. Wound healing is a whole other thing when you're on immunosuppressants. It's slower, it's not as robust, so those areas are just more prone to, well, basically falling apart.
Yeah, it's like they don't have the same reserves to bounce back from these things,
You got it. Their bodies are already running a marathon every single day. And then we haven't even talked about the digestive system. That's another big area of concern.
Oh, right, because our gut health is tied into everything.
Everything. So we worry about blockages, leaks in the intestines, anything that can disrupt that really delicate balance in the gut. And remember, even what might seem like a minor issue for you or me, for a transplant patient, it can escalate so fast.
And then, of course, there's the whole organ rejection thing looming in the background this whole time.
Right. Always. That risk never truly goes away, no matter what other procedures they need. It's this constant balancing act for their medical team. They've got to maintain enough immunosuppression to protect that transplanted organ, but not so much that it opens the door to this whole other cascade of problems. It's a tough needle to thread for sure.
It's incredible how much goes into it. And speaking of other risks, this article also mentioned cancer. I'm curious about the connection there. Why are transplant recipients more prone to cancer?
You guessed it.
Ah.
It all comes back to those immunosuppressants.
Yeah.
I know. Broken record over here. But they really are the key to this whole thing. They're life-saving, absolutely. But one of the downsides is they can increase the risk of certain types of cancer, especially the ones that are linked to viruses.
Oh, I see. Because usually our immune system is fighting off those viruses all the time.
Right. Our immune system is like this amazing security guard, constantly on patrol, getting rid of those viruses and any cells that look suspicious, like they might be turning cancerous. But when you're on immunosuppressants, it's like that security guard is, asleep on the job. They're not as effective, so those threats can slip through.
So the immune system's so busy making sure the new organ isn't attacked that it's missing these other things that might be going on.
Exactly. And that's why we see higher rates of skin cancer in transplant patients, for example. Those immunosuppressants, they dampen the body's natural defenses against sun damage. And lymphoma, too, that's a cancer of the immune system itself, and certain gastrointestinal cancers as well. It's something we watch really closely.
So based on all this, it sounds like transplant patients, they really have to be on top of their health, even years after that initial transplant.
Absolutely. It's all about being proactive. These patients need to be their own best advocates, working closely with their doctors, not being afraid to ask questions, and speaking up if anything feels off. Early detection is key, especially when it comes to something like cancer.
Absolutely. And we briefly touched on trauma earlier, but I wanted to circle back to that. What happens if a transplant patient is in, say, a car accident? How does that change things?
Oh, man. Well, first off, it's the same as with any trauma patient. It's all hands on deck. We're trying to stabilize them, address those immediate life-threatening injuries, but then you layer on the whole transplant situation.
It's like a whole other level of complexity.
Exactly. The transplant team, they need to be involved right away, not just to assess the overall injuries, but to specifically look at that transplanted organ and see if it's been affected.
So on top of everything else, they're also worried about whether the transplant is still okay.
Exactly. I mean, imagine a transplanted kidney gets damaged in the accident. That might mean they had to remove it, which is obviously devastating for the patient.
Yeah.
Or a liver injury. We've talked about how vital the liver is, right? Any kind of damage there can be extremely serious, even life-threatening.
And I'm guessing, on top of all that, there's the added worry that the trauma itself, the accident, could trigger organ rejection.
Oh, absolutely. It's a lot to juggle for sure. And these situations, they really highlight how important it is for everyone to be on the same page. I'm talking seamless communication between all the specialists involved, trauma surgeons, transplant specialists, critical care, everyone working together as a team to make sure both the patient and that precious transplanted organ come through it okay.
It's pretty incredible when you think about everything they're dealing with, especially in those high-pressure trauma situations.
It really is. The level of expertise, the coordination, it's amazing. And it just goes to show how far we've come in medicine that we can even tackle these kinds of complex cases.
It really makes you think, though, about the ethics of it all, Like, what are the ethical considerations when you've got a transplant patient who needs a risky surgery, especially if it's not even related to the transplant?
That's the million-dollar question,
Yeah.
right? And honestly, there are no easy answers. It always comes down to weighing those potential benefits of the surgery against the very real risks that we've been talking about. And of course, at the end of the day, the patient's wishes are what matters most. What are their goals? What does a good outcome look like for them? We can't lose sight of the individual in all of this.
It's about remembering that a transplant patient is more than just their transplant, right?
Exactly. They're people with their own lives, their own values, their own hopes and dreams. And those individual needs and values, those have to be front and center in every decision we make.
Couldn't have said it better myself. Wow, this deep dive has been eye-opening. I mean, who knew something as, like, quote-unquote, routine as an appendectomy could be so incredibly complex when you're talking about a transplant patient?
It's a good reminder that in medicine, there's really no such thing as routine. Every single patient is unique. They come with their own story, their own set of circumstances. There's no one-size-fits-all approach. And that's why it's so important to treat the whole person, not just the organ or the disease.
Absolutely. Well said. And to our listeners out there, if you or someone you love is a transplant recipient, we hope this deep dive has given you a better understanding of just what's involved in their care, even for those seemingly routine procedures. Knowledge is power, as they say, and being informed can make a world of difference when it comes to advocating for your own health or the health of someone you care about. And remember, you're not alone in this. There are so many incredible medical professionals out there who are dedicated to helping transplant patients navigate these complexities every step of the way.